whiskey. Oh my goodness. Okay, here we go. We are not only enjoying another drink with you today, but we are also doing another show. Let's get started. Dr. Doug Tucker, Dr. Bill Cordius. I am a practicing vet manager, and so we have a topic. We have a great topic today. This is a Dr. Tucker topic. So
Dr. Tucker.
But wait, there's more.
But wait,
we are having a beverage. As always, we are having a beverage, and this is your beverage, Doug.
This is my beverage, or my whiskey.
Doug's whiskey.
Your recommended beverage. Okay,
my ice cubes.
His ice cubes, and he mixed it. And so we drink Whistle Pig rye, the prior episode. And so we did basically the same formula, but changed out the whiskey to Ironroot Republic's Sleight of Hand rye. And so let's give it a try.
Yeah, and this will be good for comparison because our last podcast was just about 3 minutes ago.
Yeah.
So we're hammering into this, and this is going to get maybe a little bit interesting.
Oh no, this is definitely getting interesting. So stay tuned. Stay with us.
Stay with us.
You're going to love this.
Roast.
This will be good. All right. Okay.
I like that.
It's delicious.
Very
It's
good.
a delicious rhyme. Although, I did talk to the vendor. I told you I talked to the vendor, and gave me a little extra stuff from a bag on the side. Delicious. And then we did an episode with
A previous episode
Yes.
with some of their whiskeys.
with another one of their whiskeys. It's deliciousness, and so I'm a
They're
big
doing
fan.
good whiskey.
Yeah, they're doing a great job. Love Ironroot. Highly recommend. Go try it out. I think you got it at a Total Wine, right? You got it. At
I got this one at Total Wine. The other two I got actually at their distillery.
Yeah, which would be fun to do. But no, I did have it as well at a Total Wine. I did try it when I was there, so I was very excited to meet them. Nice people. So yeah.
I think
highly
this stands
recommend.
up to the Whistle Pig. I think the Whistle Pig was a little smoother. This has a little bit more flavor, I think.
Very layered flavors. I agree.
Both very good. Different.
Both very good.
Different.
Yeah.
Yeah.
And the previous ones, and I was saying this, is the tobacco bitters, or not, and
Tobacco
the
bitters.
this vermouth.
Yeah, that's a really complex vermouth. I mean, it's really good.
Little
They work well together.
Yeah.
A slight earthiness to them.
Yeah.
sweet,
Really-
and then
really
that
good.
tobacco
Classic
kind of works on
Manhattan.
it. Oh my god, the tobacco bitters. Gosh.
That was nice.
Oh, delish.
And we smoked them.
Love it, and we smoked
We
it.
did, white maple smoke on that, and we needed to really write down the recipe of the
We
first one,
do.
both of these, and because I want to make them again sometime.
God, that was delicious.
Yep.
That is definitely delicious. Okay.
All right.
Okay,
Subject.
great. Yes, let's get into it. Dr. Tucker, you have a fantastic subject today.
Debatable.
Get into it. Let's go.
So I wanted to talk about the differences between a recommendation and a requirement, and kind of where do we apply those in our clinics. The prime example is the rabies vaccine, which most states require a rabies vaccine on a state level. So you're required to administer rabies vaccine at whatever interval is on the recommendation list for that particular vial. Sometimes it's 1 year, sometimes it's 3 years. But you have to, and the state requires you, if you own a pet, to administer rabies vaccine. Local ordinance often requires you to administer rabies vaccine, have your animal registered with their city. But the veterinarians were required to recommend it, but we're not necessarily required to do it. Like, we're not required to police the rabies vaccine for the state or local government. We're only required to recommend it. And so we find ourselves, particularly with this day and age where people are more suspicious about vaccinations in general, and don't want to take the risk that their animals have an adverse event from the vaccine, or they feel like their animal's not getting exposed to rabies and it's less likely to get it, so they don't want to give it. So then we're put in a situation where do we force them to get the vaccine in order to see us, which we're completely allowed to do. So as individual veterinarians and clinics can require it to come in, otherwise they will not see you. Or do we recommend it, but then still provide services for these people? And so I kind of tend to have fallen, was for a period of time requiring it because I got scared about the legal ramifications of not requiring it. Mm-hmm. And then talking to our state board and getting some more clarification, we're actually giving some leeway with how we do this. And we're not necessarily required to require it, but we're required to recommend it. Okay. And if you decline, that is on you, the owner. They're declining it, and then we can still see your pet. And I'm okay with that. I'm okay, because the vast majority of my clientele will do the rabies vaccine. And I would even argue, and I was thinking about this the other day, and it just was this like kind of moment that clarity, which you probably already know. Bill's a smarter guy than me, but we probably wouldn't, our profession wouldn't even exist the way it exists right now if it wasn't for the rabies vaccine. 30 to 50,000 people every year die from rabies outside of this country. In sub-Saharan Africa, Asia, India, a little bit like sub-Saharan, like India, Asia, little bit of South America. 30 to 50,000, most of these are children, die from rabies because they're not vaccinating these animals. They're not vaccinating the animals in their communities nearly like we do in this country. No one dies from rabies in the United States.
Which is an easy vaccine
and so
to obtain.
It's an easy vaccine to obtain, it's an easy vaccine to give. It's relatively safe for vaccination. So all these
side effects.
We are blessed with the fact that I actually even have this option with a client to recommend it, but then still see their pet because we're so penetrated in prevention that we're able to have pets live in our house, sleep in our beds with almost zero risk from contracting rabies. And these are like animal-specific rabies, like dog rabies, that 30, 50,000 people die a horrific death. It's a horrific death to die from
horrible
rabies.
death. Horrible death.
Horrible death. And most of these are children on this planet every year. And we're able to do that in this country because of, and practice the way we practice, have pets the way we have them. I would argue almost not solely, but primarily because of the vaccine strategy, particularly rabies, because it's a zoonotic disease, meaning it can spread from dogs to people.
Dogs to human. So,
dogs to human. So I think our profession actually is almost like this new thing because of that vaccination. Because we couldn't have pets this close to us and live with them like this close to us without it.
That's kind of what I'm saying.
It's a great vaccine, great thing to do. Please vaccinate your pet for rabies. First of all, we recommend it, but are we going to require it to see your pet? That's where we kind of sometimes see differences in clinic and with other people.
Just a PSA really quickly. Just remember, people who watch, your animal is still an animal. I mean, it does have tendencies of animalistic behavior. So you have to remember these dogs and cats that we have, yes, they are our pets and we love them very much, but you have to appreciate the fact that they are still an animal, and we have to appreciate the fact they have prey drives, they have behaviors that are innate, and we need to appreciate the things. And in doing that, if you're going to bring them into your house, you're going to love on them. People have all kinds of exotics in their homes. That you remember these things because you are taking all of that in with it. And if you're not going to behave with that,
and you're not just protecting yourself and your family, you're protecting your community as well. You're protecting your neighbors.
Exactly.
And so as long as we have like 95% plus people vaccinated for rabies, we're probably going to be good. And that's where we're kind of pretty much at. But we do have clientele. Like I have a great client whose dog had a reaction to rabies, an anaphylactic type reaction, and she doesn't want to vaccinate for rabies. And I'm like, I don't want to cause another anaphylactic reaction in your dog. So I can do some things to maybe help prevent that.
Right.
And I'll recommend it, but I understand why you're declining it. You're a wonderful pet owner, because she is. I'm going to still see your pet, and so we're kind of in that trick box a little bit with it. And then then there's other things, but that's probably one of the primary ones. But certainly we can talk about lab work prior to anesthesia. We talk about heartworm prevention and the heartworm test. I have clients that decline the heartworm test sometimes for financial reasons, and then I become compelled. Okay, do I require this or recommend it every year? I recommend it every year, but I'm not going to make someone get a heartworm test if they want to wait 6 months or a year or do it the following year. I'm still always going to recommend it, but I'm going to give them their heartworm prevention because they still want to keep their animal on prevention. I can see they're keeping their animal on prevention, and so I'm going to keep them on prevention. I think that's more important than to take that heartworm test.
The variables are important as well.
So it becomes like something as clinicians, do we require something in order to see you, or do we recommend it and then document we recommended it, which we do, we document. All right, I'm sorry, I've drawn on enough. Please, colleague, input, I'm sorry.
All right. So on your stuff and all, a little bit of difference. Number one, we can recommend rabies vaccine. Yeah, that's fine. Actually, our job is, or what we're required to do, is to inform our clients that the rabies vaccine is required by the state. Not to recommend it necessarily, but to inform. It's a little bit of difference there. So it's a bit different saying, I recommend you get a rabies vaccine versus, I need to let you know, Texas state law requires you to have a rabies vaccination regardless of anything.
Yeah, and
Right. And so, that's part of it. Number two, I think there's a miscommunication or a misnomer by veterinarians that they can write a waiver for a rabies vaccine.
Yeah.
We are not
That is
allowed
great
to write
point.
waivers for rabies vaccines. We are allowed to write a request for a waiver, which the owner has to produce and take to the Department of Safety Health Services.
but they don't even.
Well, that's the law. And
Right.
then what that allows for is just registration of the pet. The pet is still considered legally unvaccinated
And required.
and is not exempt of any of the laws that any other unvaccinated dog for rabies or cat for rabies would face. So I think it's important. There are a lot of veterinarians, I think, that are misinformed, that don't understand that and pass that on to the owners and say, well, we'll write a waiver for you and you're off the hook. Nope. The law is the law, and unless somebody changes it, that's the way it is. So we have to inform them that it's required.
Yes.
And I do recommend it. And
Yes.
I agree with you. And it's very important. What is the likelihood you will ever see rabies in our lifetime from one of our patients?
Have you ever diagnosed rabies?
Nope.
No, neither have I. Never
Okay.
seen a case of rabies. Never
You
diagnosed.
think you're going to see one in the next 10 years?
No.
All right. I would say this, one of the big reasons why, because of
Rabies vaccine.
mass vaccination.
Fascinating.
Thank God. Okay. All right.
So, quick question, just to inform our viewers, what happens if a pet comes in who the owner chooses not to vaccinate? And I'm gonna ask you this first, Dr. Cordius. What happens if a client comes in, I don't want to vaccinate, hasn't vaccinated in quite some time? You've been seeing it because it's you know the life of the pet, and you know its history. You've been seeing it for, let's say, 5 years. The pet bites somebody, notifies you that the pet bites somebody. Now what happens when the pet has been seen by you and has bitten somebody?
All right, we might bitten by somebody like somebody in my practice or somebody
Let's just say
outside.
in your practice.
So so this enters leading into, again, certain practices will require patients to have rabies to even come in. I think
Correct.
one of the
Which they actually have a right to do.
they have a right to do.
Yes.
I mean, they absolutely
and I
do.
support that.
And I think this is one of the ends, and this is kind of the struggle I have on that, because I don't want to deny a pet that needs treatment for a critical condition
Correct.
that is not up to date for their rabies. And I'm certainly not going to pick the time a dog comes in hypovolemic shock from being hit by a car and say, hey, let's go ahead and get this dog his rabies vaccination on board, which isn't going to make a difference anyways, but
Correct.
just to be in compliance.
Yeah.
So I think that we need to understand that distinction and everything.
Yeah.
But one of the struggles is, and one of the things I think as veterinarians, that when we get into that basically that protocol of saying, hey, listen, I'm not going to require you to have your pet vaccinated against rabies, is that does causes some stress on our staff.
Mm-hmm.
Because now our staff, who many times might not get a say in that policy, are faced with, hey, I've got to be doing the grunt work. They're more likely to get bitten than the veterinarian.
Correct.
Getting blood samples, treating, placing catheters or whatever,
Nail
and
trimmings, all
all,
those things.
anything.
Correct.
And they're the ones who are most at risk. And so I think as veterinarians, we sometimes forget that, and we kind of focus a little bit too much on the pet and say, well, and I don't want to upset the owner, and they're worried about that dog having a problem.
Mm-hmm.
We forget, what about our staff? Because they have to live with that stress. And what happens when they're bitten by a cat who hasn't seen a vet in 10 years? And maybe they go outside some. Those scenarios do happen.
It does.
And so it's easy for us when we're at low risk for getting bitten ourselves to take on that burden for ourselves, but for our staff, I think that's an unfair burden to take. So I'll say this, right now where I'm at is, generally speaking, I do not require a rabies vaccine for a pet to come in. I do indicate people it's required by law, but I think it's an important thing to take my staff into consideration. Admittedly, I don't think I've been good enough about that lately. I've just recently started thinking about this. They have to factor into this too. It's not just the veterinarian, not just the pet, not just the owner. Actually, the people who are most at risk in that situation, that's our staff.
Okay.
And they're not getting considered.
I've been pulling them aside and asking them if they're in a situation like that. If you're not comfortable seeing this pet, I completely understand. I'll go in there by myself and talk to them, and we'll figure things out. We'll kind of assess the risk and, in the potential, and then we can come back and powwow about it. I think this animal is unlikely to have this. It looks like it's had some vaccines in the past. Are you comfortable with seeing this with me? And so I'll kind of give them some agency in that, or I'll try to. But yeah, it's a hard thing to kind of. I wish everybody was just compliant and just do it. But I understand there are times at which there are concerns with the vaccine and its reaction.
As leadership in an office, and for because I create a lot of awareness of the staff concerns, and I kind of, because they have so many things and they're diagnosticians and they're kind of working through the process, I come in and I'm like, hey, listen, if you don't want to vaccinate, I will have no problem in you doing that. That is not my biggest concern. My biggest concern is my staff. So I will create in the office, and I know you and I have had these discussions, Dr. Tucker, is where I'll say, that's fine if you choose not, as the physician, not to vaccinate the animal, but as proxy to staff.
I'm not choosing to not vaccinate the animal.
You're choosing to
I'm choosing to see the animal.
Okay, let me say it like this.
The client's choosing not to vaccinate.
You're choosing to treat without the vaccine.
I'm choosing to go ahead and treat the animal for whatever condition they come into and their problem they have.
Correct.
Without having the vaccine as a requirement.
Okay, that's fine.
But I recommend it. I always recommend it. I always talk, like he mentioned, about how it is a requirement of the state. If they choose not to do it, that is on them.
100%.
And I try and go into like that whole spiel with the people die from rabies outside of this country.
Yes.
And it's a serious zoonotic
you're
disease.
very good at informing.
So you need to be okay with this. But I'm also cognizant of the fact of we've been so successful with the vaccine. It's given us a little bit of leeway, in certain circumstances, to allow clients to not vaccinate or not require them to vaccinate as well, and not be so stringent about it.
And that'll hold up until enough people don't vaccinate, that we start seeing rabies again. If people start dying horrible, terrible deaths, and then all of a sudden, that's going to come back to
like the measles vaccine in people.
Well, they're only worse. But and then it comes back to, then what will the requirements be by state law? And that may end up being that your pet cannot go anywhere publicly.
You're going to be stranglehold, and you're not going to like that. So to me, bare minimum is, I think it's not a huge ask, just because you've seen such great results with doing that. However, I reserve the right, as when we discuss things, is I'm like, okay, listen, I'm okay if you don't want to treat, but I'm not going to do anything above and beyond.
It's also a fractious animal. And that's another play. Like if it's an animal that tends to be fractious, then that becomes a whole nother.
But you don't understand it. When you're doing this also, it may not be fractious today, but when it comes in for the nail trim and then we discover that it doesn't like nail trims, or
most of those people don't have that many touches. Most of those people don't have like if they have a bunch of touches in the clinic, then
grooming's a big one.
Then it becomes another layer, and then it's like we need to do this vaccine, and then I might make it a requirement. Actually, if we're going to have a lot of touches in clinic, meaning you're coming in for nail trims, you're coming in for, then I might start. Then I'm going to be more. Then I might make it a requirement. I've done that before, where I was like, I'm going to require you. I'm going to get this vaccine. Your animal's getting contacted too much with us. I've seen some fractious behavior with the animal. You're going to have to do it, otherwise, And so we reserve that right, and so I can make it a requirement if needed.
Or myself, I sometimes do as well. I'm like, okay, the line, there's a line, and there's a fair line in which we say, okay, listen, we will treat as to the comfortability of the doctor, but then past that, where the doctor is no longer involved, such as a nail trim and all those extra grooming, bathing, things like that, I'm like, I have to draw a line and say, we just can't, because there is a level of protection we have to give to not only the staff, but your pet, because things can happen.
And by the way, your dog.
If we discover that your animal doesn't like a nail trim, if we discover your animal doesn't like a nail trim, and then we do the nail trim, and the animal bites, then what happens?
Well, you got to go into quarantine.
Okay, so let's talk about that a little bit.
That's
I'm
one
going to take
thing
a little lead here, if you can give me a moment.
Yes,
you guys going to give me a moment?
that.
All right,
Please,
so here we
Dr.
go.
Porteous.
Those are things to consider too, in all. And so again, our staff, having them taking them into consideration, and what happens if they do get bit by that unvaccinated animal. And I've seen this happen before. And basically, if it's a bad bite, they go get attention. They get medical attention. They need it. They should absolutely. And then on top of that, what happens is a bite report is filled out. Typically when they're seeing the physician for their bite wound. The city is automatically notified that there has been a human bite, and then the owner is contacted and told that their pet must go to quarantine. And quarantine is going to be for 10 days typically after the bite. And I've had a few times in my career, even most of these have been actually before I've been an owner, where I've seen pet owners come unglued because then it comes to, well, your staff is incompetent, they're failures, they should never have gotten bitten in the first place by our aggressive dog, and never mind the fact that here's this person trying to do their job who's not getting paid a mound of money every year, who's been injured, who's painful, and who has to sit there and worry about, I hope and pray to God I don't get rabies. And by the way, do I need to actually have to go under rabies vaccination myself?
Which they do.
And so all those things factor in.
People are being jerks about it.
When you look at all that, it makes a very compelling argument in my mind to say, hey, if you're going to walk in the door, your dog needs to be vaccinated for rabies. And the problem is that if we're feeling like, look, I mean, they're really not going to come in unless they're really sick or hit by a car, or they're coming in for their annual vaccinations. Well, when that really painful animal comes in, that hit by a car animal comes in, that's a really big risk for getting bit. Painful animals aren't of the right mind. They're reflexive. These are instinctual things. They're not being mean. It'd be the sweetest dog or cat in the entire world, but they're in that much pain, somebody's going to get bit. That's the last time. Last thing you want to have to worry about at that point is, now have I been exposed to rabies or not? Has my staff been exposed to rabies or not?
Particularly if they're acting sick.
And so these things all come. And then on top of that is, and I don't know the answer to this, and it'd be interesting to find out. I mean, I don't know liability-wise if our staff is bitten by an animal that's unvaccinated for rabies because we've allowed that animal to come into the practice. That's a good question of where's the liability lie on that? And, does that staff or team member have the right to file a lawsuit? I don't know.
Well, that kind of happened to us, and we were lucky enough. The gentleman decided he didn't want to report it, and he decided to go outside of our company and
We recommended that he use us. Use our.
We recommended it, yes, but he decided to go outside of it.
Because he was a veteran and he went to the VA.
We didn't get into that. He decided to go outside of the company, and they recommended that he get rabies vaccinated.
He got the full thing.
He got the full thing. So had that not happened, had he chose not to, he would have been required to report it, and it would have been a whole thing.
We would have supported him, and we would have done the stuff we needed to do.
100%. And we told him to do it this way, but he is a lover of animals first, and I applaud that, and I can't really say anything negative about that, of course. But it's a sad situation that an owner can be put in that situation, and it's not by any fault of the vet or the staff, because of course during any procedures that our staffs do, nobody wants to get bit, whether the animal's completely vaccinated or not.
And I would just interject, like the VA did a great job, like treating him. I mean, they were like not messing around. They go,
There was- yeah.
what am I saying?
They were
They just did it. They
They were
just put them
great.
through the whole
Bravo to
gamut, and they did a great job,
They did a
like
great job.
treating them and stuff. And I'm like,
Um,
I was a little bit surprised. 'Cause I think if most people went to like a regular physician, they would have, do we need to do this? Do we not need to do
well,
this?
maybe
Do we
not.
need to-"
Maybe not. They probably
You
would
know,
have done the same thing.
maybe
It's-
watch and wait and see and get reports and whatever.
Well,
But
they leave it-
they took action. I was like, that's awesome.
Well, they give everyone the right to choose to do it. They gave him that. They
didn't give him-
highly. No, yes,
They didn't give
did.
me.
highly
They said they
recommend
didn't
it.
give me a choice. They just did it. He's
Oh
like,
well, okay.
he's like, we're
maybe I
going to do
wasn't
this.
with
And,
that.
So let's go. Let's bring it around. We're getting a little off track. So
Yeah.
because we were originally on what is required and what is recommended. All right. So rabies is just one of many things.
yeah.
That at the end of the day, the owner makes that decision. It's our
Yes.
job to have them make an informed. This is required.
Yeah, and
Okay.
so going back to that whole concept, like there are a lot of clinics, a lot of vets like require certain benchmarks for their clients to do every year. They have them as requirements versus recommendations, and a requirement is like something like a line in the sand, if you will. You would do these things to come into this clinic, and do that. And like I tend to do more recommendations. I tend to talk to clients about the things I would recommend. We have a discussion about what that might mean and the importance of it or whatever. And if they decline, they decline. And often they decline because of they're trying to save some money. And I'm trying to help their pets as best I can within a financial means, that without actually just saying that, hey, is this within your financial means, whatever? Because most people don't really like to hear.
They don't want to talk about their
No, you
finances.
don't. What's your budget? What's your budget for this? Like, have you thought about this? They don't want to really think about
And
that in
doctors
their
do
pet.
not want to talk about money.
Yeah. And so you just kind of like have to say, I recommend this. I think this will be good.
So what's
is
another-
it really necessary? Well, it's not absolutely necessary for me to treat, but I recommend it because this will help me treat. It's like, can we not do it? Okay, we'll just do X, Y, and Z.
Is there another recommended
X,
slash?
Y, not Z.
Well, I think there are several things. I think part of it does come down to also, how much culpability should a pet owner have to bear? And I'll give an example, and let me run through this. One example is pre-anesthetic lab work. Hey, your dog's going to undergo anesthesia, and we need to run lab work to make sure that's a safe thing to do. Our practice, it's not a recommendation, it's a requirement.
Oh, really?
One of the
Okay.
reasons it's a requirement is because I've been through 4 years of undergraduate and 4 years of vet school, and I've been practicing for a long time. I've been through a lot of continuing education, and based on that background and my education and all, I know that it is very important to do lab work on that pet. That I do not believe is a choice I should leave in an owner's hands who has not gone through undergraduate education, veterinary college, continuing education,
Right.
and is well versed and understands all the ins and outs and the risks of anesthesia. So turning into that decision over to an owner, saying, hey, do you want to run the lab work? We recommend it, but you don't have to, I think puts too much culpability on the owner. They are not qualified to make that decision.
Question. What does explain?
So pre-anesthetic lab work would
lab
be blood work to check, hey, liver, kidneys okay?
Okay.
Are there any problems with anemia, blood clotting, or anything like that? So basic lab work, just like when we go in. Anytime I've gone in for a surgical procedure, I've had wrist, hand, knee procedures and all. I've never been given the option of,
Right.
hey, we'd like to ask. We recommend doing the lab work, but that's up to you. Right off the bat, they know it's important.
Right.
They know there's risks.
It's part of it.
And they know also that they're the healthcare professionals. I'm not educated in that. And I may be a veterinarian, but I'm not a physician.
Correct.
And so I'm not qualified to make that decision. Therefore, it's not left to me. So I'll make the argument any day of the week that I don't think that leaving that decision in the hands of a pet owner is appropriate. Nor would I leave in the hands of the pet owner, an anesthetic protocol. I mean, I could take it to that level. Well, we can sit there and
Yeah,
say,
what's the
but,
anesthetic
well, but
protocol?
bear with me on this. I mean,
Yeah.
you're giving them the power of, do they feel, making them make a decision for lab work. I could just as easily make the comparison that Well, do you want to have your dog to be intubated under gas anesthesia during this process? Would you like an IV catheter or not? You know, we recommend those things, and it would be best if you did those, but they are more expensive and all. And do you want pain medications post-operatively? Sure. There was quite a period of time when a lot of veterinarians in our profession offered pain medications as an option.
Wow.
You know, either A, you can let your pet sit there and suffer, or B, we can give them some medication. Well, doc, how much is the medication? Well, it's $25. I think it'll be all right. You know, is that fair to have a pet owner make that decision? Doug over here is dying. He's gonna. So here you go.
I don't want to look at him because I know he's.
You know where I feel. We're trained. They're not. We'll make the decision.
I respect you like 100%. I think you're an awesome vet, and I
Here it comes.
completely support that, making that a requirement on your practice. I, through experience and time, and you're right, I make requirements with how I do anesthesia and the way I do anesthesia. Thanks to a lot to you and us bunching together. Some of those anesthetic things or anesthetic protocols I've done, you guys helped put those together at the previous place we worked at, and I follow.
We've built on them.
I follow a lot of those things to a T, and I find that protocol works great. I place catheters in all my pets. They're on fluids. They're monitored. They're on an EKG. They're on blood pressure. We're at pulse ox. We're monitoring them closely. I have multiple staff involved. I just don't have one person in a corner doing the dental, doing everything. I have two people. I have someone monitoring anesthesia, someone doing the procedure, and these are generally brief procedures in healthy pets, healthy animals. So I've had a high degree of success doing that without lab work. Mm-hmm. You know, do I like lab work? Is lab work important? Do I see lab work? Do clients sometimes do lab work? Have I caught things in the past on lab work that kind of gave me pause about doing the procedure? Yes, maybe a handful. It's important, but I have also had like so many of these cases. Like, it's just too many to count. Successfully run anesthesia, successfully performed it because they're not long anesthesia product. They're not under very long. They're not. They're usually young, relatively young. The older they are, it becomes more prudent to do lab work. It becomes more of a hard recommendation. You do it, but if you know what you're saying, Dr. Tucker, I can afford $450, but I simply can't afford $650. Then I might not do it. You know, because the animal's otherwise been healthy. They're just older. And so there are times in which I like to do blood work. I like having blood work at least a few months in advance, knowing what the blood work looks like. Absolutely, it's helpful, but it's not necessary for a lot of these cases because the anesthesia really isn't that long. We're doing so many other things too to make sure it's healthy and safe during the anesthesia that I don't find it as necessary to do some of these things, particularly routine dentals.
Will you not do a procedure based on history?
Yeah. Oh, yeah. Yeah.
Will you say, I have to have the blood work?
I mean, if they're not eating, they're sick, they're vomiting, they're not feeling well, they're losing weight. Okay. I'm like, we might need to not do this and investigate this reason first. And then we're doing blood work to investigate a problem. Okay. You know, so yeah. But if they're
like, I want to do a dental, the dog's mouth is yucky, it's got to get done. Will you say, listen, I'll do it, but we got to do the pre-anesthetic blood work first. I got to make sure this dog is healthy. Will you have that conversation?
Ideally, yeah. Okay. Oh, yeah.
Well, I'm asking. I know. I happen to know, but I'm just asking so that you can explain to what your line, because his is different. His is like, no, it's got to happen.
Yeah, he makes it a blanket requirement, so he doesn't have to. So he just has to make that the standard of care in his practice, and that's totally valid.
Right. 100%.
So part of my argument will be this: certainly, if you want to make the argument that as long as they seem healthy and everything's fine, I'm okay doing that, and all. I would go on to say that usually by the time animals are visibly sick from kidney disease in particular, which was anesthesia is the biggie with because of the hypotensive effects of the gas anesthetic and all. That relying on that as my cue to, hey, I have to put my foot down and say no, or we have to run lab work. I'm going to look at that and say, I don't feel that's a very good standard. I don't. There are a lot of animals that can have significant kidney issues, and I have seen this in the past, even running senior lab work on pets that are otherwise healthy, and coming to find out that, hey, we've got some significant kidney disease going on here that I would have no idea on earth is happening at this point in time. And I would argue and say that if I put that pet under anesthesia to do their teeth because they seemed healthy, and the owner said, look, I can't afford to do the anesthesia lab work, but I can afford to do the other stuff, I would tell you I am likely to do more harm to that dog's kidneys and hurt its overall long-term health by doing that anesthesia than I am to help them out by doing the dental. That's my take on it.
So the animal is like, let's say an 8-year-old dog.
8-year-old dog.
8-year-old dog, like grade 3 teeth. Like
grade 3 teeth, okay.
You know it needs the teeth. Otherwise, it's been healthy. Otherwise,
Healthy, okay,
doing
yeah, great, yeah.
You know, clients like, good dog, I can afford this, but another $200 towards the procedure, I just can't handle.
Okay.
You wouldn't do the dental. Like this animal's
Okay.
maybe painful, nothing,
All right.
And you know.
Yeah, I know. I hear what you're saying,
Stuff,
but run with me on this. You've given me the parameters.
Yeah.
Okay. Now let's take that same patient, and let's add in. I do lab work on it, and I find out that its kidney values are 4 times normal. Now, my question to you would be: would you do the dental on that dog?
It depends on the level of disease.
So the only difference here is running the lab work and not running the lab work, but that's making a difference.
If there is it depends on the level of azotemia, and it depends on the level.
But you don't know based on, hey, my dog seems fine.
4 times I would actually not do the dental.
Okay, so you wouldn't, but yeah, you can see that. I've seen that a number of times.
Like
right.
probably 2.
Right.
And the creatinine's like
But
8.
my argument is this: many times bear with me. Many times I've seen, and the dog seems fine. And I've come across that a number of times where it's like, whoa, these are really significant elevations. And because of that, I looked at that and I said, I'm not doing the dental. Whereas if I hadn't done the lab work, I'd do the dental. And why am I not doing the dental? Because I'm that concerned about the dog's kidneys. And to take the argument that, well, but I wouldn't be that concerned if I didn't run lab work.
Right.
I look at that, it's kind of proving the point that that's why you run the lab work. You're really running that lab work to find those patients that could slip by.
Sure.
Because you're not going to do the sick dogs, vomiting sick, losing weight. No, we're not doing a dental. Your dog's very sick. We need to find out what's going on.
The benefit of the lab work, benefit of preoperative lab work is to uncover underlying disease.
It's specifically there for you to keep you from making that mistake. That's my argument. To keep you from being lulled into your pet looks fine, but
however, the number of dogs that fall into that category are
one's
very
too many.
Small.
One's too many. If it's your dog, just like if it's your kid. If you went to the hospital with your kid, and we're not going to argue about kids versus people. I'm just going to make you go to the hospital with your kid.
Kids versus dogs.
All right, your kid. Hey, if it's my kid, it's too many. The first thing I want to know is if I'm that situation and the doctor, they don't run any lab work, and I find out my kid's suffered because of the procedure.
We're
hold on, wait. Hold on. I'm not going to get down that road just yet. I'm saying unacceptable. It's unacceptable. And the doctor to turn around and say, I asked you if you wanted to run the lab work. Well, hell, if I knew it was that important, I would have run the lab work. But you let me decide. You said you recommended it. And I just didn't know. I didn't have that level of education to understand the importance.
So once again, kind of falls back to, do you want, like the pet owner, do you want a human level of care for your animal, or do you want to go sub that? Like, do you think about your animal like as like an animal that lives with you? You love it, but you don't want to put your money like that, or not? I mean, do you want to put it up to a level of anthropomorphizing your animal to make it like a little human being in your household? Then yes, you should do the lab work. You should do everything we do in human medicine, for sure. But there are clients and people that don't want to do that.
I agree, and I 100%.
And
My
so
argument is this, though.
The
problem is they're educated in that realm as far as where they hold their pet in esteem with the level of human life, if you will, or life in general. But they're not educated medically to understand the importance of doing those things. That's why we go to vet school. We go to undergraduate, we go to vet school, we go to continuing education, we keep up with our trade and everything so that we can make those decisions and not ask an owner who's not qualified to make those decisions.
The problem is I do all these other things as part of the requirement running anesthesia and monitoring my animals during anesthesia.
But then why stop short there?
Or so brief.
But why stop short there?
Because it's like another $200 where some people may not be able to afford that or they don't want to do that.
So why don't we do this? And could we just cut the IV fluids?
No,
where's the cutoff? That's the whole thing.
I like the IV fluids. I know, but well, then they can go to TCAP. They go somewhere else where they don't do IV fluids, and they can do a dental for $200. And so that's where the client has a choice to go somewhere to do a $200 dental, where they're not going to do a catheter and not to put the animal on fluids.
They're not qualified. This is where we get them. Is it unmuzzled or unleashed?
This is definitely an unleashed and unmuzzled.
Yes, this is what Doug and I do, by the way. And we love it.
Okay.
And we love it and all. So
I don't disagree with you.
I think that you both have valid points.
And that's the whole thing about recommendation requirement. And I love it. That's great. That's how you feel. I feel, well, once again, I like doing blood work. I recommend blood work. But I've done so many anesthetic procedures and seen animals so successfully make it through that it just, I don't require it.
There's definitely valid points
unless
on both ends.
Older
and I think that there's different strokes for different folks. However, I feel like we have a plan in our business that offers you in our business and our clinic. It offers you a puppy plan. It's a puppy year thing. Anyway, I just because I just wanted to kind of like just set this mark.
Please don't sell a puppy plan.
I'm not going to sell a puppy plan. What I'm saying is it's in this particular plan, it offers like with your spay and neuter, you get like a pre-anesthetic package with it.
Blood work comes with the plan.
Blood work comes with the plan. And by doing that in your during your spay or neuters, which is hopefully the first surgery your dog has to go through, it creates a baseline, which in all fairness, we all have a baseline of blood work that we do in our
it's helpful
in our human existence that kind of creates who we are. It kind of finds things and whatnot. Okay, not to get too deep. So in fairness to Dr. Cordius, it does create that baseline where it allows us to see things. Because it's such a good point that it does help us find things in that initial surgery of life that kind of helps us find any differentials that come throughout the life.
Allow me to defend myself on this.
You don't need to defend yourself. What I'm saying is this is a great...
She wants me to do more blood work.
Hold on. Well, let me finish.
I'll let you finish and I'll interject.
Please. And because this is where we're about to end. So I want to say this is such a good test because dogs coming from different places, mills and breeders and all these different places and rescue, it really helps us find things that could be missed early on in their life. And it creates this lovely baseline of support for the doctor, okay? In saying
more tests is always good. More tests is always
100%.
Good.
To a point which you and I will actually argue together about that. We'll talk about that another subject to a point.
In saying
the thinking doctor. Go back to the thinking doctor.
In saying that, it also, there's so many benefits to that particular situation. But we have these beautiful parents that come in and they're like fosters and they're coming in and they're taking on these new animals for the first time and they don't know what to do. So upon recommendation, based on this new addition to their family, they bring this animal in and I just want to do what's best for my pet. I want to do a spay and neuter. This is what I was told this is the best thing for my animal. It helps with cancers later on in life, 100%. And they follow those recommendations. They get those initial surgeries, and it's all great and fine. And the surgery ends up being fine. We don't know a lot about this animal, but we do our very best. So there are beautiful things about both aspects because it could help us in this surgery find things before or during. However, we want to make sure that in both of those scenarios, in totally different views of practice, that we are doing the best that we can.
No,
however,
we're not totally different views.
It's not totally different.
We actually
They're
probably, on the Venn diagram, we probably align a ton.
This is the whole thing. This is the recommendation.
Like this, with a little bit of sliver over on this side, and a little bit of sliver on this side, and that's what practice is all about. That's what practice is.
This is the recommendation. This is the baseline practices. This is the foundational practice. This is the standard.
Everybody has different places they draw their line. I do want to counter one thing and I appreciate you've had so many times, you've had no problems whatsoever throughout your years of practicing with animals going under anesthesia for these procedures. I'm talking. So, I probably average, I would say 3 to 5 cases a year that we do the lab work, those patients should not have gone under anesthesia, and they didn't. And because of that, that is why I don't put that decision in the owner's lap. And everything's fine until it's not. And that comes back on me. If, God forbid, I feel responsible if I didn't have that as a requirement. I don't want to find out, which is going to cost the owner 20 times more in money and in heartbreak, that, hey, we shouldn't have put your pet under anesthesia for an elective procedure had we known that they weren't a candidate for that.
The reason why it hasn't bitten me in the ass is because I've made a recommendation, and the client knowingly, and this is the vast majority of clients that have made these decisions, and I knowingly made a decision not to do it. And then they take responsibility for that decision. So I make the recommendation, I say, really we recommend like recent blood work. We're having a blood panel in our pocket, that they're healthy for anesthesia. That being said, I'm very comfortable with how we run anesthesia. I think we run an amazing protocol where we monitor them very closely and how they do.
I mirror you 1,000% on that.
A lot of the things we do are like,
we basically do the same anesthesia.
Yeah.
Yep.
So,
except for the lab work. No.
I often have lab work because I do recommend it, but I just don't make it a hard requirement, which I understand, and you make a really good argument to do that, and it makes me kind of think about it, honestly, but I'm convinced but not convinced, We'll see, but you make a good argument.
So, going forward, because this was your topic, what's indicated and what's recommended, and I think that's, at the end of the day, that's that line that's drawn on almost the majority of stuff we do.
It's about practicing, being able to practice based on your own experience and what your own values are.
And at what point do you say, look, Mr. Jones, I'm sorry, but we have to do this. This is going to be required.
And I do. It's going to be required for me to understand what's going on with your pet to treat your pet, and I do that. This kind of falls back to my being so client-centric, and why being client-centric can bite me in the ass sometimes.
Yes.
Being so client-centric, trying to do what the client wants to do, it serves me very well, and it's hard for me to get off that and be vet-centric, because that's a vet-centric point of view.
On some level, but not completely.
Yeah. Or animal-centric, because it's not client-centric.
Because at some point, being client-centric also means
taking the option out of them.
Telling them, hey, listen.
But that's why they employ
doing this to keep you from getting into trouble.
But that's why they employ us to do these things for their pets. And so if I'm making the recommendation and they're declining it for other values that they're imparting on that relationship. Okay?
But that's right. But there certainly is. There's always going to be that line in the sand. I would imagine I can't imagine there isn't anything you do where you would say, no matter what, I'll do what the owner wants. Hey,
No,
case in point,
no,
case in
definitely
point, anesthesia.
situational.
Case in point, anesthesia. You're not going to say, hey, listen,
Well,
no
just look at-
catheter. You can take the choice on the catheter.
Right. I'm not going
That- that's-
I don't
It's
do
very
that
situational.
because I know there's other clinics that will do it without
It's
a catheter
required.
or whatever, and
But
they'll
you
do
required in your
yeah,
practice.
I do require
Yeah.
IV catheter. It's too beneficial. Too beneficial to have that venous access. We do a lot of injectable drugs. It makes us use less drugs, so it makes it safer for anesthesia.
You require pain
And so
medications.
I do require pain
do.
medications. I require
Yes,
pain medications.
absolutely.
I require hooking up to monitors. I mean, and so I do have that. The things I think are absolutely necessary and required to do it well. Lab work
Lab work's the one year. All right. So
kind of depends on the case.
in-
How
in this-
heavy I
yeah.
recommend it versus maybe even require it to do something. Because there's times when I've required it, and I was like, we need to do the blood work on
I've
your
seen
animal.
that.
Your animal is like, they have a history of a problem. We need to check this out before we do this, and to do this safely.
Well,
And so,
this is fantastic. This is very informative.
Oh, we're not done.
we probably should have done. I don't know time-wise.
Yeah,
We're probably
there.
over and all, but
We're there.
I do. I think that I do want to kind of capitalize on the fact that there's always going to be requirements and recommendations, and there are two extremes. And there are some practices you should go to, and I'm not going to argue.
Requirements are very black and
where
white.
everything is required. Period.
I like living in the gray.
You like to live in the gray.
Requirements are black and white. Recommendations creates like little
Yeah.
little levels of gray.
They become conversations between the owners
And become more
the
like
vet.
it engenders more discussion with the owner,
And,
more
and then you get some scenarios where it's just all
understanding,
recommendations.
a better
Correct.
understanding
Just
of
all,
what's going on.
So when you go, say, for the hyper low cost place, hey, you want to save some money? Do you want us to use a catheter in your dog? How much is that? $20. Nah. Would you like pain medications for your dog? How much is that? $30. Nah. Do you want us to use gas anesthesia for your dog or just injectable? Which is cheaper? Injectable. Yeah, no gas. Those are the blatant representations of,
Yeah.
well, we recommend it, but you can decide. And let's be honest, some of those are borderline cruelty to animals, I feel, in
100%.
some of those situations. They're not giving
100%.
any reasonable pain medication or anything like that,
Yeah.
or they have bad outcomes. Interesting, I've seen a number of those over the years
Yeah.
where I have had owners come in and they're infuriated, they're angry, they're very upset. What do you think? I want a
Dog's in
second
pain.
opinion on this. And I'm
Right.
like, yeah, we don't give those as options and all. Well, I don't understand. And I will be the first to tell you, I'm the one to say, well, did they recommend any of that? Well, yeah, but if I knew it was important, I would have done it. But ultimately, and that's when I have to tell them, I can't help you out. You decline those things.
Right.
And true, at our practice, we wouldn't have given you a choice, but I don't know what you're wanting me to write a letter saying what? I don't know what you're trying to get me to say here.
Yeah.
If they told you don't do it, it's unnecessary and it's not recommended, I can write you a letter saying that is substandard medicine. And that's the gray zone. And that's the area where that's the balance. How much of that power
They
do you
need to
give
take,
you,
and that's
the
where
owner?
it goes
So
into a whole other conversation.
So,
So
yeah.
I have
It's a conversation.
one
about
spectrum to the other.
What's your culpability as a client in your
Sure.
decisions and what you do? And so if we're giving you options and you pick this option, then you've got to just all stand by it at the end of the day. If you've made that decision from a cost perspective, then that's okay. It's okay to do that. And I don't want to be against clients and say, like, you've got to spend this kind of money to even own a pet. I just want to be cognizant of what they want to do.
Yeah, you
And
want them
so-
part of the conversation, and that's completely understandable.
Sure, and Doug and I oscillate, and we do. We work in the balance of that. I know that. We picked the
Right.
pre-anesthetic lab work because I think it'd be neat for people to see that argument play out, which everybody did, much to Denise's chagrin here. She's like, but this is what Doug and I do and all, and that's why we love each other so much. And so, but I would fathom the guess, and Doug saying this earlier, where we are so similar, is that we do have a lot of those times when there are pets that have problems, and they are given options, guidance, and recommendations. The 16-year-old cat who's got kidney problems, I will tell that client, hey, listen, ideally we would do a complete kidney workup, x-rays, ultrasound, urine protein testing, urine cultures, all these tests and everything. Could potentially even be, although very unlikely, a kidney biopsy, but a full kidney workup is ideally recommended. However, your cat is 16, and I'm happy to guide you in that direction, and that's an opportunity where I tell people, ball's in your court, I'll let you decide.
Okay.
Or we can go with diet or whatever.
Real quick, I want you to do it because you're too wordy. I want you to let them know what's the difference between a recommendation and a requirement.
I thought I did good.
No, hold on.
Because I kind of shut up towards the end. I know I went
sum up.
heavy
What's the
handed at the
recommendation?
beginning.
All right, so I'm going to tell you, in our practice, I probably most of them, a recommendation would be where the veterinarian tells somebody, hey, it would be best, we believe it is best, and we recommend you do this particular treatment or procedure. A requirement would be saying to somebody, look, if you're going to have treatment in our hospital, this is required. It's not open for negotiation. Either you get treatment here and we do this, or you get treatment somewhere else, which is certainly your right and your prerogative.
Okay.
That's it.
That's it.
That's
I
in
love
our
it.
practice.
I love it. Have a good conversation with your vet, whoever they may be, and just listen to them, take those recommendations, talk about it for a couple of days if you need to, but just do what's best for you and your family at the end of the day. Just love on your pets. That's all we ask.
Yeah. At the end of the day, keep a good. That's why it's important to have a good relationship with your veterinarian.
Yes.
So you can have conversations. They get to know your pet, get to know you, and they get to you. Everybody makes those decisions together, and that's what I like. That's what I love about this, and I love having those kind of relationships. And most of the time, you'll follow my recommendations when we do that, but sometimes there might be things I don't really understand why you're making those decisions, but you make them for yourself. Most of you guys understand that, and we've had that conversation.
Yeah. Anyway, thank you. Everybody have a good evening. Have a good night. Thank you.
Soon.
Prost.
That was a long one. Seemed really